Thank you for being with us this morning.
Turn his camera.
Chairman Flick,
Can you-
Vice Chair Guerra,
Can
members of the committee, thank you so much for letting me, for giving me the opportunity to testify. My name is Alberto Gutierrez, the real Beto, born and raised in Stark County here in the Valley.
Dr. Gutierrez, could you possibly turn your camera on?
I thought it was on. Okay, just a second.
There you go.
Thank
Am I
you.
on
There
now?
it is. Great. That's awesome. Thank you.
Okay. University of Texas at Austin graduate, medical school, medical center, Galveston, internship, Fresno, California, Fresno County General Hospital. I'm so old, we didn't have residencies back then. 1 year and then into practice. 2 years in the Air Force, South Carolina. And then I practiced for 30 years in Carlsbad, New Mexico. My dad asked me to come home 23 years ago, so I'm back in the Valley for the last 23 years. It's going to be a tough act following Dr. Villarreal. She was so good at what she said and what she did. And I'm going to echo some of what she already proposed to you guys. I had a large practice. I turned it over to a young doctor 8 years ago. And now I work for administration at Doctors Hospital Renaissance. I also have volunteered at the Hope Family Health Center for 21 years, medical director for the last 15. I've been practicing medicine now for 54 years. And I'm not president of anything, but I have treated, as of November of 1998, 1 million patients. I'm working on my second million right now. Good medicine? No, but in Carlsbad, I was the only Hispanic in town. And my name, address, phone number was in the phone book. And I did work 24/7. And we did not have, back in the 70s, 80s, we didn't have hospitalists. We didn't have ER doctors. We had to manage our own patients in the emergency room, in the office, in the streets. I have volunteered again at the Hope Clinic for the last 21 years that I mentioned. We started very small. The Hope Clinic was established by a nun and a priest 26 years ago when they saw how many of our poor indigent populace here in the Valley were not getting proper medical care, could not afford it. 15 years ago, we went broke. We depend on grants and donations. We're not involved with any government entity to keep our clinic open. Donations are a big part, as are grants. And 15 years ago, we were almost broke. And I had a talk with a man named Alonso Cantu, and he and the administration at DHR started Fishing for Hope tournament, and that gives us some money to keep going. So we're back to full operations again. We service now over 5,000 patients a year. And again, these are very, very poor patients. Some walk to the clinic, some ride bikes, some have to ask for a ride. And we do the best we can taking care of these patients. And the outcome is that we keep them out of doctors' offices, we keep them out of the emergency room, and we do pay for services. We have to pay for their surgeries, imaging, hospital stays. And I have to get on the phone and not beg, but ask the surgeons to please give us a break because we don't have that much money. As most of you know, the Valley consists of 4 counties: Cameron, Willacy, Hidalgo, and Starr. Our area is one of the 10th poorest in the United States, has been and will probably continue to be for a while. Our area has 1.5 million people living in that area, 90% of Hispanic ancestry. 40% of our populace live under the poverty level. And again, I'm going to echo a lot of what Dr. Villarreal said as far as poverty in the valley. Many of our poor patients live in communities called colonias, substandard living, poor sanitation, plywood houses, cardboard rooms. And this leads to a lot of health issues. Our uninsured rate that we read from stats is 30%, double this, and double what Texas, the rest of Texas has, and triple what the nation has. At the Hope Clinic, we treat all individuals who have no coverage. And for years, most of these are very, very poor people. However, in the last couple of years, I have been seeing educated people with degrees, teachers, social workers, who says they cannot afford insurance. And as long as they have no coverage, we see them and take care of them, and I treat them like I would any private patient. Our biggest health issues in the valley, Dr. mentioned already, obesity, hypertension, diabetes, and of course, depression. The stats we got from reading from the regional healthcare stats show that our area is 28% diabetics. And I don't think that's completely accurate. In my practice, 40% were diabetics. And the only section of populace that compares to us as far as diabetes are the Pima Indians in Arizona. And diabetes, as you guys know, leads to cardiovascular disease, peripheral vascular disease, loss of eyesight, and it also impacts the kidneys a lot. So diabetes, end result, has a lot of health issues with it. At our clinic, we try to prescribe generic medicines only. These are the $4 kind. And often our patients don't even have the $4. And we at the clinic give them the $4 to buy medications. I often see patients in the clinic who haven't taken their insulin for 2 and 3 months. Sugars up in the 400 and 500s, normal sugars 100. In summary, and I'm going to make this short, lack of funds, lack of medical providers, and the high percentage of indigent families in the valley are in dire need of additional funding, more reasonable prices for medications, and as Dr. Villarreal mentioned already, they need better access to medical help. The Valley has been Texas' stepchild for years, and you all know that, but we are catching up. Doctors Hospital Renaissance recently was designated Level 1 Trauma Center, the only one south of San Antonio. Will be able to service everybody south of San Antonio. We also have currently Driscoll Hospital Pediatric is going to build a 43-bed hospital adjacent to our pediatric, adjoining DHR. And that's going to provide the best of pediatric care to the valley, where our mothers don't have to go to San Antonio or Houston to get care for their kids. We do have a medical school now in our residency program. We have 2 nursing programs, but we need more. So in summary, what I'm asking, or what we need, are investment in training more healthcare workers, doctors and nurses. Right now at DHR, we have many empty beds. We cannot bring patients in because we don't have nurses to administer health care. Investment in education. You know, I don't know the answer to poverty. education appears to be the best way to cover that poverty. Offer blue-collar jobs to some of these poor young males and females, carpentry, mechanics, plumbing, so they can get off the streets and maybe have a trade. That would help. We need to expand Medicaid. So many of our constituents down here need that help. They have no other recourses. We need some programs to reduce the price of healthy foodstuffs. We need help from the state to help some of our indigents be able to buy medicines at a lower price. I don't know how you fix that, but again, many of our poor patients cannot afford even the $4 medication. Transportation, another big factor. Many of our patients cannot afford transportation. Some walk to our clinic. As I mentioned before, they ride bicycles or ask a daughter or son to leave work and bring them to the clinic. Maybe there could be some program where those that are in poverty levels can have some kind of a ID and be able to afford transportation to healthcare workers. And that is about all I can want to tell the committee, that we are in the poorest section of the state, of the nation, and we need help for better access care to our poor indigent patients here in the Valley. I would like to answer any questions the committee may have at this point.
Representative Guerra.
Mi amigo doctor, how are you?
I miss having lunch with you.
Yes, we need to. I find you very enlightening. Could you explain to the committee, because we must keep in mind that this committee represents the state of Texas as a whole. Why is all these issues that you've brought up this morning important to all of Texans? Why is it important that we focus on these issues that you've just discussed?
Well, Rep. Guerra, first of all, not taking care of these health issues leads to early death for a lot of my patients. I lose a lot of 60-year-olds with diabetes and hypertension, partly because of poor care. Very important that we provide more access to health care. I want a patient to live a little longer. I want to enjoy life a little longer. Let me bring in something. Last summer, I had a 42-year-old illegal. He's a cook at a Chick-fil-A. He walked 2 miles to the clinic. And he says, "Doctor, something's wrong with my foot." I took off his boot. He had gangrene of the left foot. He didn't come up yesterday. He'd been working for 2 weeks with gangrene on his left foot. I said, "Rodolfo, why in the hell didn't you go see a doctor?" "I don't have any money. I can't afford it." "I heard you here at the whole clinic and help me." This is the kind of stuff we see. And of course, he had amputation. But it's very, very sad to see this kind of things happening, and we see it often. So it is an issue. We need more access to health care, more providers, more nurses, more education. Poverty is nemesis. Poverty, I don't know how you can conquer poverty. Education probably is one of the best ways to do it. Getting these people better jobs, educate them as far as dietary needs, nutrition, but it's all very, very important. I've practiced in 4 states. I've practiced in California, South Carolina, New Mexico, and now the Valley. I've never, ever seen the poverty that we have here in the Valley. South Carolina had a large populace of poor people of color, but nothing compared to the Valley. We got to make it better. And you guys are our biggest hope. You members of this committee hopefully can help us. Help us in access to better health care, more providers, etc.
Thank you.
Other questions, members? Chair recognizes that Representative Weiner and Representative Collier have joined us.